Hello, everybody. Welcome to Miss McGuire video lectures. And today we are covering the muscular system. And this is the second video. I'm using OpenStack's Anatomy and Physiology textbook. We already covered part of this PowerPoint in the first video. And I will just gonna pick up exactly where we stopped, right? So let's go ahead and begin. So muscles of facial expression. So let me check if my PowerPoint works. Okay, it works, good. So muscles of facial expression, those are skeletal muscles. That means they are voluntary. You can control their contraction. The difference is that they are inserted into your skin. Each muscle has origin and insertion. And many of your muscles have origin on a bone and insertion on a bone, and you're moving those bones. Muscles of facial expression inserted into your skin, and they're moving your skin. So on this diagram, you can see several of them, like frontalis. The name of this muscle is occipital frontalis. Because you can see it has like this frontal belly and posterior occipital belly, and it's connected by epicranial aponeurosis that is connective tissue. So it's really considered to be one muscle, right? So, but we just call it frontalis muscle, occipitalis muscle. So whatever works for you. Now, another muscle shown here is orbicularis oculi. That's a circular muscle around your eyes, orbicularis oris around your mouth. And you do have lots of other muscles here, like, for example, mentalis, depressor anguli ori, zygomaticus muscles. Right, so on the next slide, we do have details for all these muscles, like here's occipital frontalis, frontal belly, the movement, the target, right, origin, insertion. So we will discuss muscles, of course, during our labs. So right now, I will only focus on few of them. So please stop this video and read this table, okay? And then continue on. Here we have another table and some more muscles here, like levator labiis superioris. And the name itself gonna tell you that this muscle gonna elevate your lips, right? And it will be in the superior region. Or depressor labii inferioris. This one gonna be inferior to the previous muscle, right? Superioris, and it's gonna depress your lips. You also have depressor angulus oris, and this one will depress the angles of your lips. Zygomaticus major, the action in smiling, right? And it's kind of pulls the corners of your mouth up, right? So now also you see how we have origin and insertion over here. So you can see that origin is zygomatic bone and insertion will be your corners of the mouth, right? That's skin, because you always pull origin to, you always pull insertion towards origin. Now, orbicularis oris, shaping of lips during speech. Buccinator, give you a lateral movement of your cheeks, and buccinator originate on the maxilla, mandible, sphenoid bone, and it inserts into orbicularis oris. Now, this mentalis muscle, it's a protrusion of lower lip and pouting, so you kind of like lift your chin up, and it's originate on the mandible, and it sorts in the underneath skin of chin. So again, take a minute to go over this diagram and, maybe memorize action, origin, insertion, right? And of course, the name. Intrinsic eye muscles. So those are muscles that move your eyeballs, and their insertion will be a sclera, or this white part of the eye. And we have really like good amount of them, right? So we have 4 rectus muscles. So we have superior rectus, we have inferior rectus, we have medial rectus, and we have lateral rectus. So this one is shown medial. So that would be right there, close to your nose, right? So you see this is a nasal bone. So they cut lateral rectus so you can see that medial side. So remember, medial what? Towards midline of your body. So we have 2 rectus, superior, inferior, medial, and lateral. And then we have superior oblique and inferior oblique. Right, so here's our superior oblique right there, and inferior oblique is right here. So now, really like this diagram, this is not even correct. I checked it, but that comes with our book, and I think there is an error over here. But this table is correct, and you know what? How I memorize it, and you might come up with a different idea. So all your rectus, superior, inferior, lateral, and medial, pretty much move your eye according to their name. Like superior rectus, move your eyeball up, right? Eyeball. So it elevates. Inferior, down, depresses, right? Lateral moves away from a nose. So it's a lateral rotation. Medial rotation. Now, inferior and superior oblique are opposite. Inferior oblique gonna elevate and superior gonna depress, right? And so at least remember these functions, right? And then if you look over here, that pretty much I think the only stuff that is incorrect here, you see how superior rectus goes up, right? And superior oblique here should be inferior oblique. And here our inferior rectus and superior oblique. But then your obliques move to the lateral side, and your superior and inferior rectus and medial rectus move to the medial side. So I know it's a handful. We do need to remember name of those muscles and their prime movement. So they elevate, depress, lateral rotation, and medial rotation of the eye. Right? Now, muscles of mastication. Mastication is anatomical term for chewing, right? And you have several muscles involved, like temporalis, one of them, masseter, and pterygoid. So pterygoid, we have lateral and medial pterygoid muscles. And temporalis and masseters are superficial, and pterygoid are deep. Now, pretty much, if you look over here, that most of them, they close your mouth. Like, look here, masseter, close your mouth. Temporalis, close your mouth. Medial pterygoid closes your mouth. And lateral pterygoid, this is the one that opens your mouth, right? They all target mandible, because mandible is really, right, the only one movable bone of your skull. So masseter originate on the zygomatic arch and insert into mandible. Temporalis originate on temporal bone, inserts into mandible, right? And, you know, I will not hold you responsible for memorizing origin and insertion of this lateral and medial pterygoid, just make sure you kind of, you can find them on a diagram, right? So again, lateral and medial pterygoid, and they are deep muscles. Then you have muscles that move your tongue. And when you move your tongue, you help mastication, you help chewing, you have swallowing, that term for swallowing is deglutition, and of course, speech. And here's our major muscles over here. So that's a little bony projection on a temporal bone is called, styloid process. So you have muscle go from styloid to your tongue, and tongue, the anatomy, I'm not sure, is it Greek or Latin word for tongue is glossus. So glossus means tongue. So you have styla, glossus. So from styloid to the tongue, right? Now this bone is hyoid bone. So this is hyoglossus, and this is your mandible, and this muscle is gynoglossus. And another muscle is palatoglossus. So it's from your palate to the tongue again, right? So those are muscles that move the tongue. So here you have a summary. Again, here's your muscles and movement, and they all target tongue, and you will always find this glossus in their name, right? So also you have intrinsic muscles of the tongue. So extrinsic, they move your tongue, and intrinsic are actually muscles that make your tongue. So here's our gynoglossus, styloglossus, palatoglossus, and hyoglossus that we just discussed. So gynoglossus originates in the mandible, allow movement downwards. And actually, you kind of, if you see muscle on the picture, so you see that's the muscle, right, over here. And you can imagine when this muscle contracts, right, the tongue will go down, right? Now, styloglossus originate on styloid, and you can see when this contracts, that will move your tongue upward and back. Palatoglossus originate on a soft palate, and it's also elevates your tongue. So again, if this is our palatoglossus muscle, right, over here, and if they contract, you can see the tongue will go up. And if this is hyoid bone, so this is hyoglossus, you see like, okay, what's gonna happen if these muscles contract, then it will move your tongue down. So downward movement and flattening of your tongue. So really this location of muscle fibers, and if you remember that we always pull insertion towards origin, if you see them on a picture, you should be pretty good with their action. Muscles of the anterior neck. Oh my goodness, look over here. We have like so many of them. 650 muscles, right? But let's just make sense, and we're just gonna really divide them into compartments, and I think that's gonna be good for us. So their function is deglutition, that is swallowing, and speech. So they classified into two major groups based on their position relative to hyoid bone. And here's your hyoid bone. So we have suprahyoid, so here's the name. So supra means above, so that's a group above hyoid bone, and infrahyoid muscles below, right? And you can see over here, like mylohyoid, stylohyoid, digastric, right? So we have good number of muscles. So we're covering digastric muscles. And this is this one. So here's our anterior belly, and here's the posterior belly right there, right? And it elevates hyoid and larynx. So you can see, because it's connected to hyoid bone, when you contract, the hyoid bone will go up. And then we have sternohyoid that The name itself tells you, so it will go from the sternum, right? So, so here, you have your sternum here. So you go, so it has this notch. So that's the muscle from sternum to hyoid. And usually, always, yeah, I think it's always in the muscle's name, we start with origin. And so we start with origin. Sternum means the origin is sternum and insertion is hyoid bone. And what we're gonna do, we're gonna pretty much pull insertion towards origin. And you see when these fibers get shorter, we will depress hyoid bone. Now, muscles that move the head. So actually your neck region is divided into anterior triangle, posterior triangle by this muscle that is called sternocleidomastoid. And this is really kind of like the major mover and rotator. And it's also gonna depress your head, right? So sternocleidomastoid shown right here. And this is the muscle that you can see on the neck. So this bulk of muscle over here, right? And it's go from sternum and clavicle. That's why it's sternocleido, from sternum and clavicle. And it will go towards your temporal bone. And we have mastoid process. You can palpate your mastoid process. This is like a bony part just behind your ear. And this is where the insertion is. So sternocleidomastoid is this muscle over here. Then on the posterior side, we have muscle that is called splenius capitis. And it's inserted into your occipital bone. And this will hyperextend your head, right? So, and, we will not look at deep muscles at this point. But here, again, the summary, we have sternocleidomastoid and we have splenius capitis. So sternocleidomastoid rotates and tilts head to the side and tilts head forward. And splenius capitis rotates and tilts head to the side and tilts head backward, right? Okay. So sternocleidomastoid, major muscles that flexes and rotates head. Muscle of the posterior neck and back. Now, so not only neck, but we including back over here. So neck muscles like splenius capitis or splenius, splenius capitis over here. And we didn't look at others yet. So they involved in a head movement. So pretty much to move a head, the insertion need to be a skull, right? That's some bone on the skull. Is it an occipital bone or it's a mastoid process of temporal bone, right? But whatever is inserted into your vertebra, for example, you have splenius cervicus, then the insertion are cervical vertebra. So you can, move your neck, but you will not move your head, right? If it makes sense, right? So here it's a, if it's still as a head movement, then we kind of should expect the muscles to be attached to the skull, right? Back muscles, they stabilize and move vertebral column and they group by length and direction of fascicles. Back muscles, they are in several layers. First of all, here, we don't even see the superficial muscles like your trapezius, for example, right? Deep to trapezius, we have rhomboidus, major, minor, we have serratus, posterior, superior, right? Those muscles, they stabilize your scapula. They maybe even posterior muscles like latissimus dorsi move your arm. Now we're specifically talking about muscles that underneath all of these, underneath trapezius, underneath rhomboidus, underneath the serratus, posterior. Those muscles that stabilize your vertebral column. So they're pretty deep muscles. And we have a splenius group, like splenius capitis and splenius cervicus, right? And they extend and lateral flex and rotate head. So extend and then lateral flex and rotate, right? That's a movement. Then we have the whole group. It's called erector spinae group. And the name erector means that's what keeps you upright. So it's erect your back. So it also does a flexion, lateral flexion, and rotation of vertebral column. I would say, well, how does flexion? I would say extension. Erector spinae group. Why it says flexion over here? Let me think about it. I think that's wrong, because erector spinae group is on the back, so there is no way it will flex. It will extend. Now, those groups include iliocostalis, longissimus, and spinalis. And so this is like not really good pictures because they just put so many muscles here that we are confused here, right? But the spinalis group will be close to the spinous processes, right? So that will be the spinalis group, right? Then the more lateral gonna be iliocostalis group, right? So over here, that will be iliocostalis. And right between them gonna be longissimus group, right? So right between them will be longissimus. Hope it makes sense, because spinalis, think about your vertebral column, your spinous processes, so it's really close to midline. Iliocostalis, you kind of go to costa, and costa are your ribs, and longissimus is right between them. Now, of course, because it's a group, right, it includes several muscles within a group. So we just want to remember erector spinae group and these three groups that are part of erector spinae: iliocostalis, longissimus, and spinalis. Muscles of abdomen, and again, we really, here it's in a thorax, so I'm sorry. So muscles of the abdomen, we have 4 pairs of muscles and they are in layer. So we have actually the kind of like in the middle, right? It's rectus abdominus. Rectus means straight, so it's pretty straight muscle. And this one is interesting, originate on a pubic bone and inserts into xiphoid process of the sternum. So it kind of, backwards, and that's flex your spinal column. That's flex your back, because the erector spinae extends. We already figured out that it was some typo. So rectus femoris, then you have on a side, you have 2 oblique, external oblique, and deep to it will be internal oblique. And the deepest one is transverse abdominus. So that's kind of like under this internal and external oblique muscles. Over here, we can really, you see how fibers go, right? External oblique, fibers go kind of the way if you want to put your hands inside your pockets, right? Then internal oblique goes the opposite way. And then you have transversus abdominus that go kind of horizontally. So you can see that, and those are pretty thin muscles if you don't train them. If you train them, you have the 6 packs, right? That's your rectus abdominis. But really, those are, not very bulky muscles, but because we have fibers running in different directions, they give you pretty good protection to your abdomen and abdominal organs, because that's the cavity that is not protected by any bony structure. right? Oh, except you have vertebral column on the back, but that protects your spinal cord. Now in the middle, right here, I don't know if you can see it or you can see my video, but this line is called linea alba. Linea line alba, like albina means white. It's a white fibrous band. It's anterior midline of body. And then we have like these tendons go across, and this is called tendinous intersections. And those are segments of rectus abdominis. And this is what give you this six-pack look if you exercise and train your rectus abdominis, right? We do have some other muscles. They form the posterior wall of the abdomen, like quadratus lumboris, for example, over here, right? So that's also part of the abdominal, muscles that form this abdominal cavity, but it's a posterior wall. So here you can see the our muscles, external and internal oblique, that twist the waist and bending to the side, bending your body to the side. Rectus abdominis, you know, that's the one that flexes your vertebral column, flexes. And when you sitting up, you use this muscle. So that's a good exercise to train it. And then transversus abdominis are, well, let's read the movement. Squeezing abdomen during forceful exhalation, defecation, urination, childbirth. So this is very deep muscle, and it doesn't really affect your, you know, vertebral columns that much, because, you know, you either rotate your vertebral column, flex or extend or hyperextend. This one mostly, you know, for your functioning such as defecation, urination, exhalation. All right, so, and by the way, it's very kind of like difficult muscle to train because it's so deep. And the best exercise, what I heard, like when you wake up in the morning before you have your breakfast, you can still be in a, you know, you still can be in your bed and you need to suck your tongue in as much as you can. So you suck it in, and that's what make your transversus abdominis to contract. And then you know, you relax. You suck your belly in again and relax. And this is a good exercise for transversus abdominis. And these muscles, we're gonna look at it. That's a diaphragm, and the diagram is before the picture. So diaphragm is a skeletal muscle that separates thoracic and abdominal cavity and involved in breathing. It's a dome-shaped structure when it's at rest. It's involved in an interesting maneuver that's called Valsalva maneuver. Valsalva maneuver is, so if you kind of get the air in and you're trying to push the air out without opening your mouth, right? And you kind of like when you go number 2, right? During defecation or urination, or when you push this baby out, right? That's a Valsalva maneuver. And what I say is that it's actually calms you down. I mean, it drops your pressure, and before taking your test, if you're really nervous, you have anxiety, you can do this Valsalva maneuver, like, and it just calms you down. So we will try. So of course, diaphragm will have openings, right? Like esophageal hiatus, aortic hiatus. So that, and caval openings. So for vena cava, so some blood vessels go through diaphragm, right? Like inferior vena cava, esophagus, go from thoracic to abdominal, and aortic hiatus, it's your, you know, thoracic abdomen goes through the diaphragm and become abdominal aorta. But it's interesting also that if you look over here, okay, let's go the previous one. And you see the diaphragm originate on your sternum and ribs, low ribs, right? 6 through 12, and also lumbar vertebra. So sternum, ribs, vertebra, so it's kind of like, you can see it's kind of like cover you, but insertion is different. Insertion is central tendon. And you see this white structure over here, that's a tendon. So that's a connective tissue. So it doesn't really have insertion on, you know, any kind of like particular bone, right? But you can see then what happens when this contracts, right, or relax. So that's why your diaphragm involved in inhalation and exhalation, because it's a compresses and compression and expansion of your thoracic cavity. That makes sense, right? So you can see when you contract, right? So when you contract, actually, you have a dome shape. That's very interesting. So you have a dome shape of the muscle, and when you contract, it became flat. And when it became flat and increased the volume of the thoracic cavity. So let's repeat. So it's a dome shape structure, right? Like this. Now you contract. You know, when stuff contracts, it became shorter. So it's straight line now. And the volume of thoracic cavity increases, and it's allow you to inhale. But I think you will cover more of this topic in a respiratory system. We also have muscles between ribs, and ribs in anatomy are called costa. So muscles are intercostal. So we have internal and external intercostal muscles, and they also involved in breathing. And this is how I remember it. So look, E, I, E. So that means if it's your external intercostal, then it's for inspiration or inhalation. If it's internal intercostal, then it's exhalation. So internal, E with I with E, right? And E with I, right? So external in inhalation, internal in exhalation. Yeah, that's pretty much their job. Okay. We have diaphragm that separates thoracic and abdominal cavity. We actually have pelvic diaphragm as well. So, you know, if you remember a pelvis, right, that is made from hip bones or os coxa, and then you have sacrum and coccyx. You probably saw there is like opening over there, right? There is a hole between those bones, a space. So obviously you need to close it up. If you do not close it with bones, you close it with muscles. Otherwise, pelvic organs will just fall down, right? So pelvic diaphragm is inferior portion of pelvic cavity, and it keeps your pelvic organs and abdominal, you know, organs inside your cavities. And it's also assist, of course, in the defecation and urination. And pelvic diaphragm is made of two major group of muscle, levator ani and ischiococcygeus, or just coccygeus muscle, right? So, so here you see our levator ani muscle. And right, so right there, iliococcygeus muscles, right? That you have puba coccygeus. Anyway, these muscles, I mean, we're just gonna call them pelvic diaphragm, okay? So that's the muscles that we're gonna learn And I think that would be pretty good. If you can remember all the muscles that we cover, I think that's a good start. Right now, perineum. How perineum is different from this pelvic floor or pelvic diaphragm? Well, perineum includes pelvic diaphragm, and it also includes other organs, like, for example, external reproductive organs. So that's a perineum. It's actually the diamond-shaped space that go from the anus towards the external genitalia, right? So it includes urogenital triangle over here and anal triangle. So you can see even here, it's interesting, gluteus maximus. You can see over here, right? So mostly if you compare male and female perineum, we do have different external genitalia, but most of the muscles are the same. We're just gonna point some of them, like this one that is called external anal sphincter right there. Right, and this is what you can control because it's skeletal muscle and it prevents you from pooping in your pants, right? That external anal sphincter. Then we also will have external urethral sphincter in the females, or they called it sphincter urethrovaginalis, because it's around the urethra and vagina. So this is a different muscle. So what we want to say is that most muscles are the same. However, some muscles found only in women and some only in men, right? Like a compressor urethrae and sphincter urethrovaginalis, that's in women. And deep transverse perineal muscles, we do have transverse perineal, this one, and deep perineal, right, will be just so. That's our transverse perineal, and deep perineal found only in males. So here, and again, you can take a minute, pause the video, or just go back to our PowerPoints because my picture can be on your way, and study this table that will tell you superficial muscles, deep muscles of the pelvic floor and perineum. Muscles that position the pectoral girdle. So let me see, maybe this is where we would have time to stop our second video, right? Because the rest of this PowerPoint covers muscles that are related to your pelvic girdle or pectoral girdle. So that's pectoral girdle, you have your pelvic girdle, or muscles that are related to your upper limbs and lower limbs. So I think this would be a good point to stop the second video. So very, very quick review. So we actually started with muscles of facial expression. Oops, those are not them, right there. So muscles of facial expression. Then we briefly talk about muscles that move your eye. It's extrinsic eye muscles. We talk about muscles of mastication. We talk about muscles that move your tongue. Then muscles in your, it's called anterior triangle of your neck. That would be suprahyoid and infrahyoid group. Then we said the muscles that move your head, right? Sternocleidomastoids, splenius capitis. Then we talk about deep muscles of the back, and those muscles stabilize your vertebral column. And you would say like, how about all this, you know, like trapezius, latissimus dorsi, like rhomboidus. Those muscles are found on your back, but they actually involved in movement of your shoulders and your arm. So that's for the next video. So deep muscles of the back. So remember, we have this erector spinae group, iliocostalis, longissimus, and spinalis. We also talk about muscles of the abdomen, including this nice 4 pairs of muscles and one deep, quadratus lumboris, that is the posterior wall of the abdomen. We talked briefly about diaphragm and intercostal muscles. And then we said, well, we have another diaphragm that is pelvic floor. And this diaphragm on the inferior portion of the pelvic cavity, and we have muscles of the perineum that form important sphincters like external anal sphincter, and in female, they form urethrovaginal sphincter. I always call it external urethral sphincter, right? And that's it for the second video. Thank you for watching, and I hope it was helpful.